Welcome back, everybody. This is Food for Thought, Thoughts If It Were You. My name is Gentrics. I am your host, and we're back. Now, we've been talking about birth control, the different types of birth control that exist for the last couple of podcasts, okay? This is the third one in this set, and, let's see here. Last time we managed to cover the birth control shot, the IUD, the birth control implant, and the vaginal ring. Today, we're going to pick up where we left off with the birth control patch in a few seconds. And then we're going to cover the birth control pill. And depending on how fast we can get into this, how fast I cover them, I might cover more. This set is going to go on for maybe another 2 or 3 podcast episodes. So don't worry, I will be done with it soon. And then we'll be moving on to the next topic, okay? Alright, everybody, and we're back. So, like I said before, the next item in the list is the birth control patch, okay? This item's effectiveness is 91%, and it costs up to $150, but it can also be $0 depending on your insurance. It does also require a prescription, so it's not something you can just straight up buy. And much like the previous two that I covered, unlike the IUD and the implant, it has to be changed regularly, okay? This one is changed once a week, okay? The patch, or transdermal contraception patch as it's known, is basically, it's fairly safe, it's simple and affordable to use. Basically, you just wear it on your skin, usually your upper belly, upper arm, in some cases your butt or your back. You have to put on a new patch every week for 3 weeks, okay? And it releases hormones that prevent pregnancy. Then you get off for a week before you repeat the cycle. So it's a 3-week cycle patch, but you change it every single week, okay? Much like the previous ones, this patch prevents pregnancy by preventing fertilization of the eggs. It keeps your body from ovulating, and it prevents sperm from reaching the egg, okay? And much like the others also, this patch does not prevent STDs, so you're still going to have to use condoms and any other kind of protection you can use, making sure yourself is clean so you can use it. To get the full effects of the patch, you have to use it correctly, okay? Make sure you use an app that tells you when it's time to change it. Note the patch change days on your calendar. Have friends or family remind you. If you have a partner that can remind you, even better. And keep the replacement patches where you can find them. Keep in mind that these have to be stored at room temperature and away from direct sunlight. You can't put them in the fridge or freezer or they'll expire. Excuse me. And you have to keep each patch sealed in its pouch until it's time to use it. Bottom line, do whatever works for you. Just make sure you change the patch every week and you don't put it anywhere it doesn't need to be, okay? And its effectiveness will be ensured, okay? The birth control patch is easy to put on, okay? Basically, you just stick a new patch to a clean, dry skin area, usually the belly, upper arm, your buttocks, usually the butt cheeks, or your back, but not your breasts. Don't ever put it there, because there's no way for it to be effective in that spot for some obvious reasons. Wear the patch for a week, 7 days, take it off, put on a new one. You do this for 3 weeks, then you go a week without it, and then you repeat it. This is to give the enzymes in the patch time to cycle through your body and all the old ones to go out so that when the new ones come in, it's effective, okay? Make sure you do it every week, okay? This will be your patch change day, the same day every week when you change them. So if you do it on Monday, you change it on Monday, okay? Don't wear the same patch much longer than a week anyway, okay? Otherwise, it's not going to be very effective, okay? Open the pouch by tearing it along the top or the side. Peel back the foil to make it flat. Then take the patch and the plastic layer off the foil. Peel half of the clear layer of the plastic away from the patch. Do not put your fingers on any of the sticky parts and place the patch on wherever you're going to place it. And then remove the other half of the plastic and press the whole patch to your skin. So basically, kind of like you peel off half, press that side down, and then using your finger, pull the other half of the protection off of the patch, and then stick it completely. Okay. Put the patch on a clean, dry area of your skin. Don't use lotions, oil, powder, makeup, or anything. Don't put any of that stuff anywhere near the patch, okay? And while you're using the patch, how do I put this? Put it in a safe spot on your body. So if you decide to go swimming, or you're sweating, or you're in a jacuzzi, hot tub, or sauna, for whatever random reason you may do so, it doesn't get washed off. And make sure you check your patch every day to make sure it's still sticking also. When you take off the old patch, fold it in half so it sticks to itself, seal it in a plastic bag, and throw it away. Do not flush this, okay? It'll help keep whatever hormones is left in the patch and from getting in the soil or anything else, or affecting someone else in a weird way, okay? If you want to get periods, don't wear the patch during the 4th week. Okay, when you'll get your period. After 7 patch-free days, put on a new one, okay? Otherwise, you can wear it during your period and you won't have it. It's really important that you put on a new patch right after your patch-free week, though. Otherwise, you risk pregnancy. It's okay if you're still bleeding or spotting during that time from when you do it, okay? And much like the other stuff, it is safe to use, okay? Your doctor will help you figure out which patch to use. There's different kinds. The chances are the patch will be totally safe for you, but for some people, there may be some problems. The hormones in the patch are the same ones in most of the other birth control medicines, especially the pills, okay? And those have been safe to use for over 50 years in the first place. Like any medication, the patch isn't right for everybody. So if you're over 35 and a smoker, you shouldn't use the patch anyway. And any other kind of birth control that contains the hormone estrogen in the first place. Excuse me. Also, avoid using the patch if you've had any health problems, such as migraine headaches with aura, where you see like flashing or zigzag lines, breast cancer, heart attack, stroke, angina, or any other serious heart problems. If you have very bad diabetes or liver disease, uncontrollable high blood pressure, blood clotting, or an inherited blood clotting disorder, such as what was it called? Oh man, it slipped my mind. Sickle cell, okay, or vein inflammation. Okay, you make sure you have to always talk to your doctor to make sure that the patch is right for you, so that you don't use it. There are risks, like I mentioned before, with any of them. Even though it's not as common, keep in mind that the hormones that the birth control can release into your body can cause certain health problems. They're not common, but they can be serious, including a heart attack, stroke, blood clot, liver tumors. And while I'm saying this, it's very rare, but in some cases, some of these can cause death, okay? I'm not going to lie to you. When you talk to your doctor about it, make sure you tell them about any medication that you're on. You don't want to just take this and be like, oh yeah, it'll work for me, but they don't know that you're taking some other weird medication like antibiotics. Antibiotics doesn't help this. Actually, it fights these hormones being placed in your body. And it can cause an imbalance in your body. And that's something you don't want, especially for people who have issues with seizures. Okay? And much like any other birth control, there's always still a slight chance that you'll still get pregnant regardless of using it. Okay? So don't get mad at your partner if you end up pregnant. Remember, it takes 2 of you to do this in the first place. Okay? Most people on the patch won't have any problems at all, but just in case, it's good to know the signs of serious issue with the patch as well. Okay? If you have sudden back, jaw pain with nausea, sweating, or trouble breathing, if you have chest pains or discomfort, achy soreness in your leg, trouble breathing, so people with asthma, severe pain in your belly or stomach area, sudden or bad headaches, headaches that are different or constantly worsen or happen more often than they should, if you're seeing flashing or zigzag lines, or if your eyes start yellowing, you need to let your doctor know. And of course, much like the others, it's also safe for people who are breastfeeding. So it's not a major issue, okay? So with all that, I don't really need to cover the negative side effects of this medication because I've already covered most of them already. There are some side effects of the patch, but like I mentioned, for most of them, within 2 to 3 months, they do disappear. They don't stay. Okay. But like I said, it can cause bleeding between periods, tender breasts, so they're tender to the touch, headaches, nausea. For some people, there'll be a little soreness where the patch is, but other than that, there's really not any major level risks except for the stuff that I just mentioned. All right, and we're back. So in the last section, I did cover birth control patches, and the next one is the birth control pill. Much like the effectiveness of the previous one, it has a 91% effectiveness rate, and it does cost between $0 to $50. This one has to be taken once a day, and it can only be received and or prescribed by doctors. You can't just go to the store and say, hey, I want birth control pills, because not all of them are going to work for you. Much like all the others, like I said before, it works the same way as the hormonal patches, the ring, and other things as well, by stopping the sperm from reaching the egg and of course preventing you from ovulating, especially during your period. Okay, same thing with this one, much like the others as well. Keep track of when you take it, have someone help you remind you if you can. Keep the pills in your bag always with you. Do not refrigerate these. I can't stress that enough. Have your partner remind you if you can. If you have a pill buddy, someone else who's also taking it, help each other remember. Keep in mind, this does not protect you from STDs, as much like all of the other ones as well, so you're still going to need the use of condoms as well. I will go over the different types in the first place. There's 2 different ones, but like I said, we'll get to that shortly. The effectiveness of it, I guess the best way to put it is, it's a 9 out of 100 chance. It's not 100%. It's never going to be 100%. The IUD implants are closer to 100%, which makes them better, like I mentioned before. But much like the ones before this one, even though this one existed the longest, there's still a chance that you'll get pregnant and or catch an STD. So make sure you keep yourself clean. Make sure your partner's clean. Make sure you let your doctor know if you're taking any medication before you get this in the first place. Keep this in mind that once you take this pill, it will take a minimum, depending on your body type and its size and or weight, a minimum of 12 to 24 hours to take effect. So you're still going to need to use a condom on the first day that you start taking them as well. There's a couple of medicines and supplements that may cause the pill not to work. And like I mentioned before, you don't want to take antibiotics with any of these birth control, contraception, what's the word I'm looking for here? Planned Parenthood suggestions. One of which is the antibiotic Rifapin. I've seen this one before. I've been on it once before. It didn't help me, actually. The reason I was taking it was because of seizures, and I had tooth pain. The problem was it was making me nauseous. It was making me tired. So if it was doing that to me and I have no need to even be on birth control, I can imagine what this would do to you if you were on birth control. Okay, the antifungal medicine supplement, griseofulvin, and of course certain HIV medicines will not work, will cause this pill to definitely not work, as the whole point of HIV medicines is to freeze the cells and help isolate the infection so they can help get rid of it. And like I mentioned before, obviously anti-seizure medications will definitely stop this from working. The other one would be the herb, the St. John's wort. Good grief. Can't talk today. I will cover that. I keep saying that, but I'm definitely going to cover what this is. If I get a chance to, I might cover it in this set too. But right now, it's not as important as what I'm covering at the moment. Okay? The pills, however, some people have asked me this already. Do you know how long the birth control pills work? How do I put this? They will start working from the time you start taking them. you can take the birth control pills any day of the month, but depending on when you start and the kind of pill you're using, it may need to use some other kind of backup birth control method, like I mentioned before, for the up to 7 days for the first time you start off taking it, like I mentioned before for the condoms. Okay, there are 2 types of birth control pills. This is something that most people don't even know is a thing. One is the progestin-only pills, or what they call the mini pills. You can take them any day of the month. You'll be protected from pregnancy after 48 hours, so 2 days. So you'll still need to use, again, some other kind of birth control backup plan, especially if you have intercourse. The other one would be combination pills, or COCs. If you start combination pills within 5 days after the first day of your period, you'll be protected from pregnancy immediately. So this has to be taken during that period. For example, if you start your period on Monday morning, you should probably start taking the pill anytime until Saturday morning, and you'll be protected from pregnancy that same day. But it has to be 5 days after your period starts, not before. As it can also stop your period from occurring and or cause complications. If you start the combination pills at any other time, however, you'll need to take the pill for 7 days before you'll be fully protected, like I mentioned before, much like some of the others. Okay. As to how to use the pill, it's pretty freaking simple. You just swallow it once every day. Try to do it at the same time every single day, and you'll be good. Okay. The combination pills contain estrogen and progestin in that one, but the other one is progestin-only. Keep in mind that they both do the same thing together, but the combination pill may have more effect on some people than the other, or some people may be allergic to the other one and they'll have to use the progestin-only one, okay? And they come in different packs, okay? Usually when the doctor prescribes them. They come in 28-day packs, 21-day packs, 91-day packs. That's the combination pill. The progestin pill, though, only comes in 28 packs, to my knowledge, at the moment, okay? Which is basically a 4-week pack, okay? If you're planning to skip your period using the pill, and I know this is a question that a lot of people are going to ask anyway, so I'm going to cover it. Basically, you just take the pill with hormones every day. This is assuming you're taking the hormone pill, and you skip your hormone-free reminder pills. You can do this in 2 ways. You can use a brand of pills that has 3 months of hormone pills in a row, so you can get your period 4 times a year. You can skip the hormone-free reminder pills in your pack and just jump right to the next pack. And you can do this every month or just whenever you want to skip your period. And that's basically the simplest way I can explain that. If you missed a birth control pill, since you take them every day, if you missed a day, just start taking it immediately the next day. It's not going to matter too much as the chemical is still in your body. However, if you've missed more than 5 days and you start taking it again, you will need to use another backup source of protection when you plan to do anything of that sort. And much like everything else, there's still a chance that you'll get pregnant, so it's not 100%. Okay? The only way you're going to be able to get a hold of this is through prescription, like I said before. So make sure you have good insurance. Your doctor prescribed it to you or such of that nature, because you can only get them from Planned Parenthood centers, the hospital, certain pharmacies like CVS and such of that nature as well. And again, like everything else, there are some disadvantages. There can be negative side effects from taking it. And, that's pretty much everything. Most of the side effects that you get from taking this medication, or any of the others, like I mentioned before, does go away between 2 to 3 months. But some people can still have some issues with them, okay? You may also notice spotting, bleeding between periods. And again, that's common, especially for the progestin pills only. For some, you may experience sore breasts, nausea, or even headaches. And like I said, these usually disappear between 2 to 3 months. If you feel sick or uncomfortable while you're taking it, stop taking it and talk to your doctor immediately. It could be the brand of the pill you're taking or the specific method, and you'll have to switch to something else. There can be more serious risks, but again, like the others, they are rare. It depends on the person. I want to stop there, but for some reason, I feel I need to give a little more insight What I mean by disadvantages here. There are side effects of just straight up stopping the pills. Also, just like the side effects of using them. Okay, the hormones in the pill leave your body in a few days. That means that any side effects you experience while using it will go away pretty quickly. Yes, this includes the positive ones like clearer skin and lighter periods. However, it can usually take a few weeks to several months before your regular menstrual cycle actually returns. So, some side effects of stopping could include PMS symptoms coming back, moods changes, including a change in your sex drive, whether it goes up or down, depends on the person. Change in vaginal discharge, change in your periods, skin changes between acne, whether you had it or not had it, or had a lot of it. And in some cases, your skin color can also change as well. And that would be about it for the birth control pill. All right, everybody, that's pretty much it. That is all for the basic birth control effects that there are for the low maintenance and the ones you have to use on a certain schedule. Okay. Next episode, I'm going to cover the ones you have to use every single time. Okay. And if I can get all of that into one episode, there's no promises, but I will definitely make an effort to make them as short as possible. I will cover on the final episode, hopefully the final episode for this, the lifestyle change birth control methods, and then the ones that I don't like the most permanent ones, okay? And honestly, just simply thinking about them is it's creepy to me. So, but putting that aside, again, this is Food for Thoughts If It Were You. This is your host, Gentrics. If you have any comments, concerns, or anything that you would suggest that you want me to cover in the future, hit me up on my Facebook, Instagram, Twitter, or my Snapchat, or just subscribe if you want to support this podcast on the anchor.fm/Neogentrix website. Until next time, enjoy the rest of your day.